Let's go over first aid. Some things we'll discuss will include shock, seizures, CPR, fractures, dislocations, poisoning, bandages, heart attacks, strain, burns, and insulin shock, but not restricted to only these. Unintentional injury in our everyday life is a major cause of morbidity and mortality. Morbidity is just the state of being unhealthy to a particular disease. Mortality is the number of deaths that are experienced. So, first aid is very important in our everyday life. That can be at home, at work, at play, and in so many places. But we need to know that not every incident that requires first aid is a life and death situation. Some are just very simple things that get to happen. For example, just cut yourself. Okay, it is not a life and death situation. But having proper knowledge of first aid can mean a lot, and it can mean the difference between life and death. Because if someone does not know, they can watch someone actually die when they can actually do something. So, common sense and a few rules are the keys to effective first aid. Very important. A person that is going to give treatment for the one who is suffering from a disease or an accident to improve his condition is called an AIDS, and the medical treatment given as aid is called first aid. Sometimes we'll refer to that one we are calling AIDS as first aider. Okay. So if an incident happens in the workplace, you cannot be helpless, just a helpless witness, since simply standing by can potentially worsen the situation. So what should you do? You need to have some basic knowledge so that you can be able to do something. First aid is the immediate and temporary care which is given to the victim of an accident or sudden illness until medical services can be obtained. First aid is going to be the assessment and intervention that can be performed by a bystand with minimal equipment until appropriate medical personnel arrives. So you don't need to do too much, even the very minimum that you can do in a situation where there is something that has happened to a person can really make a difference before those who are trained can actually get to arrive. First aider is someone who gives immediate assistance or help in the case of injury or sudden illness before the victim can be taken to a health worker or hospital. What would be some signs that there is an emergency and you need to do something? So, if you hear people screaming, calling for help, breaking glasses, okay, screeching tires, empty medicine bottles, damaged electrical wires, smoke or fire, blood, spilled chemicals, difficulty in breathing, clutching chest or throat, abnormal skin color, confusion, drowsiness, distress, all these are going to be some unusual signs, sounds, or smells, and you should be able to recognize that there is an emergency and you should be able to do something. So, there are some guiding principles or aims of first aid. The key guiding principles and purpose of first aid is going to be given by the mnemonic 3Ps. These 3 points will govern all the actions undertaken by the first aider. So the 3Ps, these are prevent, preserve, promote. So what you want to do is, as you are looking, if you look at someone that has been injured and you want to do something, the first thing is you want to prevent further injury. The next thing is you want to preserve life. The other thing is you want to promote recovery. Okay. But first thing first, you don't want the person to continue being injured. So remove whatsoever thing that is injuring that person. And whatsoever the cause, make sure that you preserve life and then promote recovery after you have done the first two. So to preserve or save life, now what will be the aims of first aid? The first thing is to preserve or save life by maintaining the life sustaining body function. This is very important. The aim is to preserve life or to save life, to sustain life. But how do you do that? You want to sustain body functions. That is, you want to make sure that the airway is functioning, breathing is happening, and blood circulation is happening. So anything that will be able to disturb airway, which will be able to disturb breathing, anything that will disturb circulation of blood, you want to remove it so that you can be able to preserve life. The other aim of first aid is to make sure that you prevent conditions from deteriorating or prevent further or additional injury. For example, you can divert possible danger. You can be directing traffic around the accident site or moving the patient away from the dangerous situation. Let's say, for example, there's a fire. You want to make sure that you remove the patient from that fire. Or you want to stop any bleeding, treat a shock, or treat other injuries. So, what you want to do is just to prevent something from worsening. Another aim is to alleviate suffering and promote recovery by preventing present injury from becoming worse. Imagine someone has already injured themselves and you can't prevent the injury. So, what you can just do is you prevent it from becoming worse. Imagine when you wrongly move a patient with fractured spine, you may cause damage to the spinal cord. So, make sure that when you have got a person like that, you want to promote recovery, and then you want also to make sure that you prevent the present injury from becoming worse. So when someone has, let's say, an injured spine, you don't want to be moving them anyhow. The aim is you want to prevent damage to the spinal cord. And when you are in such a situation, or even worse or less, what you want to do is that you want to reassure the casualty. Okay, reassure them. They need to know that of they are assured nothing bad will happen to them. Even when you know the situation is that bad, don't be telling them, "Oh, you're actually dying very soon. You in few minutes from now you are going to die." No. So reassure the casualty that it is going to be well. Another thing that you want to do is you want to relieve pain and handle with care and protect them from further harm. Another aim of first aid is to organize expert help. So you can send someone to fetch a clinical officer and safe transport to the hospital, or you can call an ambulance and give precise direction and conditions of the victim. So what you want to just make sure is that the one who has been injured is at peace. And not just at peace, but then they can be in a condition of recovery. What are some philosophies of first aid, or what is the philosophy of first aid? So, in the pre hospital setting or before going to the hospital, the key contributors to survival and recovery from illness and injury are prompt and effective maintenance of the body's primary function. So, in any first aid that you want to provide, what you want to do is you want to make sure that you maintain the body's primary function. And the body's primary function that you want to look at is the airway, breathing, circulation. So this is called the ABC: airway, breathing, circulation. Make sure that every time you see someone that has been injured or in a certain illness, are their airways okay? The nose, are they able to breathe? Okay. Is the blood circulating well? And if that happens, then well and good. Nothing that you want to make sure that you do is it to control bleeding. Bleeding can be so much life threatening because the more the blood lost, the more a person can go into a coma or just stop functioning like that, because oxygen not be able to be transported. Okay, so that is what we want to do. What is the importance of first aid anyway? So, first aid is going to be important in providing quick medical treatment until professional assistance arrives. First aid also helps ensure that the right method of administering medical assistance are provided. That is why we need to have the knowledge of first aid. Even a simple cut might end up to be something that is worse if you do not know how to handle it. So that is why you need to have knowledge of first aid, because it's going to ensure that the right method of administering medical assistance are provided. Knowledge in first aid also benefits the individual themselves. Imagine you just land yourself in such a situation. So if you have got this knowledge, you are going to be able to do something that will help you. Knowledge of also first aid is important in that it affords people with the ability to provide help during various emergency situations. Okay. So now what is the importance of first aid training? Why should you be trained in first aid? You may be the first person on a scene and you require to help you'll be required to help in order to save a life. So that is why you need to have some knowledge of first aid. Another thing is that your friends may ask you about how they could help others. So if you do not have knowledge, you might not tell them how they might help others in case they find themselves in such a situation. And you can also organize classes where you live or work and be able to also share the same knowledge that you've acquired like that. There are some golden rules that we need to know when you're talking about first aid. First thing is do first things first, quickly, quietly, and without fuss or panic. This is very important. Do first things first. Okay. And the first things first that you want to look at are the ABC. You want to make sure that someone's airway is okay, their breathing, their circulation is okay. You want to do them first. Not just first, but you need to do it quickly because the more you linger, the more the person is at risk of danger. And make sure as you are doing that, you are not panicking. Okay. Of course, some situations might force you to panic. Let's say just see a very bad accident happening, and then you're the one who's supposed to do something because no one else around has got at least some knowledge about the situation. You might be able to panic, but make sure that you know how to handle the panic. Another thing that you want to do is you want to give artificial respiration if breathing has stopped. Every second count, and you want to stop any bleeding. Artificial respiration can, well, of course, talk about it. It can include mouth to mouth breathing, or where you start pushing the chest of a person so that they can just start the heart in case the heart is not beating. Specifically, artificial respiration is where you make someone to start breathing. You can do a mouth to mouth or a mouth to nose. Important thing also want to stop any bleeding. You want to guide against or treat for shock by moving the casualty as little as possible and handling him gently. Imagine someone is in a shock, they just start behaving like that. Okay, so what you want to do is guide against or treat for shock by moving the casualty as little as possible and handling him gently. Because sometimes someone is who is in a shock might not be that gentle. So make sure that you handle them gently. Okay. So also make sure that you don't attempt to do too much. Just do the minimum that is essential to save life and prevent the condition from worsening. Anything that you do not know, don't attempt to do too much because you might just end up worsening the situation. And also make sure that you reassure the casualty and those around. Okay, so because the importance of you reassuring people is it is going to lessen the anxiety. Now imagine you are the first person who has seen an accident and then you start shouting, "Ah, this person is actually dying. This one is dead. He's dead." So make sure that you reassure people, the person in an accident, and also the people around. You need to know that the ears of the person that is in an accident or someone that has been involved in something like that will still be working. So even if they cannot respond to you, they can actually hear what you are saying. And when a person hears, they can actually have anxiety within them, and anxiety can actually kill more than even the present situation that the person is in. Also, do not allow people to crowd around the person that has been involved in this emergent situation because that can prevent the inflow of air and the person might not be able to breathe well. Remember, you want to make sure that breathing is happening, the airway is open. Do not remove clothes unnecessarily for anyone that is in a situation that requires first aid to be provided, unless otherwise. There are some situations where you need to remove clothes so that a person can be able to breathe well. And then you need also to arrange for the removal of the casualty to the care of a doctor or hospital as soon as possible. Okay. So, what to do when managing an emergency? You need to keep calm, take charge of the situation, because in this case we are taking that you are the one with highest knowledge in comparison to anyone else in the situation. So that is why you need to take charge of the situation, reassuring people who are around that is going to be well, as you are also getting to do organizing the coming in of a medical practitioner or calling an ambulance like that. Ensure the safety of self and also the casualty. In as much as you want to protect the casualty, also make sure that you protect yourself. Assess for serious and urgent symptoms. Is the person breathing? Is the person bleeding? So you look at all those things. And also reassure the casualty. Make sure that they know that something is going to be done, something is going to be well. Not telling them you are dying. Actually, you just within few minutes from now you are dying. No. You also need to make sure that you call or ask for help. And also give emergency care where you can. Okay, give emergency care. Someone is bleeding, you want to prevent a bleeding from happening. And also tell helpers who are around what to do. If you have got knowledge of what should be done, tell those who are around what to do. And also make sure that you send for medical help. What are the general principles of first aid? Prioritize and determine the injuries or cause for sudden illness. After immediate problem are under control, ask exactly what happened. So you want to prioritize and determine the injury or cause for sudden illness. You can use things like the victim or bystands. You can ask exactly what happened. The same person who has been involved, you can ask them if they are in a state of answering or just those who were watching. Or you can look for emergence medical identifications. For example, someone with diabetes will be given a diabetic band, and this can give you a clue for the sudden cause of illness. You know, okay, the reason as to why this one is experiencing this is because they've got this condition. That is why we want to look for emergence medical identification. This is an example of a diabetic band. This is for diabetes type 1. The general principles of first aid: look for and know how to look for signs and symptoms or injuries. You need to make sure that you access priorities, determine what is wrong and how severe or dangerous it is. So some things that you want to look at is breathing. On breathing, listen and look at the rise and fall of his chest if necessary. That will tell you if a person is breathing or not. You can also look at the color of the skin. For dark skinned people, you can note the palms and the sores and the lips. If you notice some abnormal color changes, you know that already something is wrong here. You also look at the circulation of blood by taking pulse or noting shock. So if you take a pulse and then you cannot feel a normal pulse, you know that circulation of blood is not well. You can also look at external bleeding. Check under clothing and part of the body under for any external bleeding. Someone might look normal, but maybe if you try to maybe lift the trousers or something, you might see that there's blood which is actually coming out. You need also to look at the level of consciousness, okay, or consciousness noting by looking at the reaction of the pupil or verbal response. This is how you see for doctors, they might move with a light. They will be able to to point on the eye to see the how the pupil is, the alertness levels, and how the pupil is reacting. Okay. You should be able also to check for fractures, open wounds, or any burns on the person. Do not remove a victim unless it is necessary for safety reasons. Also, keep the victim in the position best to his condition or injury. Do not let him get up or talk about. Okay, that is very important because imagine someone has just been injured, they just wake up, you allow them to start standing, like to start moving like that. Blood might just maybe start dripping more and more like that, and someone may just fall down and it might be their end. So also protect the victim from unnecessary manipulation and disturbance. Make sure that you control the crowd because the crowd might be saying things that the victim might hear, and the victim might just get that and be very much worried. Keep the victim warm. You can use a blanket or any cover that is available to be able to cover the victim over. Okay. What are the specific principles when managing casualty? The first thing is you need to make diagnosis. You need to determine the nature of injury or problem. Some things you look at is the history from casualty or relatives or just standbys. You also look at the signs and symptoms. What is the cause of this condition? What happened? Okay. Are there some things that happen? Does it happen really like this? So that is the history that you are trying to look at. What are some signs and symptoms that you can see in that same casualty? After you make the diagnosis, you want now to treat. You have determined the nature of the injury. You want now to treat. And you want to aim at preserving life, preventing the condition from becoming worse, and also reducing pain and suffering. Because you don't want to let a person continue. You are seeing a person suffering like that, and you want to continue watching like that. After you do what you can, you want now to transport to the hospital by any suitable available transport the casualty. What are some of the qualities of a good first aider or a good caregiver? One, they should be able to know how to preserve or keep or restore respiration. You want to know how to restart a heart that is not beating, how to control bleeding, and how to manage a casualty until expert help arrives. Because if someone is not breathing and then you are just watching, someone might just end up dying. If the heart is not bumping, need to know how to make sure that the heart starts bumping. And we'll get to talk about that also. Anyone that is bleeding, you want to make sure that you know the right thing to do when someone is bleeding. So that is how to preserve or restore respiration. Another thing that you want to be able to have as a quality is to be able to stay calm. You should not panic because if you panic, you are going to alarm the patient and anyone who is just standing by, and that might cause frustration and confusion around. And the other thing is that you need to be observant. Should be able to notice any signs and symptoms on the casualty, and those can help you on what you should be able to do as quick as possible. A good first aider should also be resourceful, meaning that it should be one who is able to make the best use of the things at hand. If you have got a cloth, how can I use this cloth in this situation? So that is the resourcefulness. And you should also be gentle. Should not be able to cause unnecessary pain. Imagine someone has just injured their head. Okay, there's a fracture, and then you start now also touching the head anyhow like that. So you need to be gentle and also tactful. Tactful meaning you should not alarm the patient. Or, for example, start saying, it looks terrible, I'm sure it's going to die very soon. That is not necessary. You need to be tactful. You shouldn't alarm the patient. You also need to be sympathetic, meaning you should be able to comfort the patient, reassure them things are going to be well. You also need to be cheerful, always happy, or has an appropriate expression that is going to inspire confidence. Not you as the first care, the first aider. You are the one who is very sad, discouraging people, telling them, I don't think anything can be done in this situation. No, be cheerful and let people learn confidence from you. Okay. Now, one important thing that is recommended in Red Cross for every first aid in a family, you at least The content of a first aid kit should have at least absorbent compressed dressing, adhesive bandages, adhesive cloth tape. You have also the sterile eye dressing, gaze pads. These gate pads are going to be used for covering cuts, scraps, grazes, and minor bends. So these are some things we can see. This is an adhesive bandage. In case you cut yourself, you can put that so that there's going to be prevention of flow of blood like that. And then this is also an adhesive cloth tape, which you can wrap around an injured place or something like that. You have got a sterile eye dressing, also a gaze pad, so that if there is any blood that is moving from a cut, you can be able to put it there so that blood can be able to move. Okay, so there are also some other medications that should be contained in a first aid kit, like hydrocortisone, antibiotics, antiseptic wipe packet, packet of aspirin, bandages, these can include roller bandages, one, and some other things here, different types of bandages. There are some things that you want to have in a first aid kit. Okay, you have got some equipment and just some other things. So some other things that you need to have: some equipment, tracers, scissors, oral thermometers, and some other things, some safety pins. Other things include blankets, breathing barrier, and some other things. Okay, so these are some things that you need to have in a first aid kit.